Okay, this lecture is more about doing experiments, and in particular, this lecture is going to focus on confounding variables that become threats to internal validity. Um, Here's the learning objective, which is really to understand and be able to identify the following 9 threats to internal validity. So in this lecture, I'm going to go over each of these 9 threats, and so you should be able to understand them and be able to identify when there could be one of these types of threats in an experimental design. Um, so in thinking about threats to internal validity, as Morling discusses in the chapter, these are really 6 of these are really only present in something that she calls the really bad experiment, and this is in a one group pretest post-test design. So typically in an experiment, if you have a pretest post-test, you want to have a comparison group. And if you don't have a comparison group, you only have a single group or a one group, that becomes a really bad experiment because it is vulnerable to these 6 potential threats to internal validity. I'm also going to review 3 other threats to internal validity that can be found in any experiment. But for the first part of this lecture, I'm going to focus on these 6 potential internal validity threats that are found in a one-group pretest post-test design. So a one-group pretest post-test design looks like the following. You've got a set of participants. You've only got one group. You take some pretest measure of the dependent variable or of the outcome. There's then some treatment, and then you measure them again on a post-test. And so some of the examples that are given in the chapter would be, let's just say that we're a camp counselor, and we've got the hypothesis that we've got a bunch of rowdy campers on our hands, but if we reduce their sugar intake by, say, limiting sugary drinks or soda, or even serving desserts at meals, that will reduce rowdy behavior. So if we take our campers and we measure them, say at the start of the week, and then we take away all the sugar, and then we measure them at the end of the week, that would be an example of this design. And what we're going to see is, in that particular example, there could be reasons why the campers are less rowdy at the end of the week, and it would have nothing to do with the reduced sugar. There could be many other factors that are responsible for that decrease, but without a comparison, you would never know. Let's take another example, having this one group pretest post-test. Let's say that you've got a new cognitive therapy that is designed to reduce depression in a group of depressed women. And so you've got this group. You measure their depression at time 1, they participate in the therapy, and then you measure their depression again at time 2, some later time. If depression goes down, we would of course like to attribute that to the therapy, but there could be other factors that are involved due to the passage of time. And again, without a comparison group, our conclusions about the effectiveness of the therapy will be limited because there could be threats to internal validity. That is, saying that it's the therapy and nothing but the therapy, which is a cause of the reduction in depression. All right. And so this is just kind of graphically describing what I was, or graphically showing what I was describing in the previous slide, is the idea with a really bad experiment that is an experiment that lacks a comparison group, is that if we get the result that would be consistent with our hypothesis, that is, with the rowdy campers example, the beginning of the week they're rowdy, at the end of the week they're less rowdy after reducing all the sugar. Is that due to the sugar, or is it due to something else? Just the passage of time. Maybe just these campers are settling in. Okay, they're away from their parents at the beginning of the week. They don't know people. They're excited to be at camp. But then after doing the same old camp activities, They're settling in, they're bored, they're used to it, they're ready to go home. So they're just not as excited as they were at the beginning of the week. That could be one explanation. What about the depressed women that attend or receive the clinical therapy? So here's their depression scores. It looks great, right? It looks like the therapy is a success. But could it be the case that depression just goes down on its own just due to the passage of time? Maybe it's the case that these women were recruited or volunteered to participate in this new therapeutic technique because they were especially depressed. They're having a tough time in their life. But maybe over the passage of time, their life just gets better. It's not nearly as bad as it was when they initially signed up for the therapy. And so it's not necessarily anything to do with the therapy, but it's just their life got better and they're just happier. Okay? So these are alternative explanations that exist because we don't have a comparison group. So I want to go over some specific versions of these threats to internal validity that serve as alternative explanations. Okay, so we've got 6 of them: maturation, history, regression to the mean, attrition, testing, and instrumentation. So I'll go over each one. So maturation is our first threat to internal validity, and maturation refers to a change in behavior that emerges spontaneously over time. So, for example, when we talk about maturation in general, we can talk about children becoming better or faster at solving math problems. Just as they get older, they mature, they get smarter. Trees get taller with age. People tend to recover from various psychological disorders like anxiety and depression. So at times, even left untreated, depression or anxiety gets better. So that's what we're talking about when we talk about maturation. We think about it like with aging, especially with children, is that children and then adolescents get more mature. But in psychology in general, we talk about maturation as just change that just happens spontaneously due to the passage of time. So in a really bad experiment, remember that there's only one group of participants and they're getting the treatment. But in a true experiment, we've got a comparison group. And this is to be able to detect whether there's potentially a maturation threat. So in the depression study that I had originally graphed, a comparison group has been added. So rather than just having the single line, we've got a therapy group and we've also got a no therapy group. Notice that the two groups are quite similar in their depression scores at pretest, but the depression scores differ at post-test, with the therapy group showing a lower depression score than the no therapy group. And so what we see is that even with the no therapy group, we likely have a maturation effect here, right? Is because their depression got better just over the passage of time. They didn't get any therapy, but their depression was reduced. So that's a maturation effect. The therapy group also has that maturation effect, but it can't just be the maturation effect, because their depression reduced even more than the comparison group. So even though there's likely to be some amount of maturation, we can say that the therapy group's depression decreased even more, and so that indicates that there's an effect of cognitive therapy as well, and that it is effective. So a comparison group helps us determine just how much of a maturation effect there is, because that's what we see in the no therapy group, and then whether the therapy in this case has an added effect, an added benefit above merely just improvement over time. All right, so next threat is a history threat. A history threat results when some external or historical event affects most members of a treatment group at the same time that the treatment is going on. And so therefore it's unclear whether the change in our dependent variable is a result of the treatment or this historical event. So what we have here in a graph is an example that is discussed in the chapter, but we've got participants in a study that were college students that were in a study, and they were encouraged to go green by reducing their energy usage. And so the start of the Go Green campaign was in October. And so the researchers measured energy consumption in September and then again in November. And the thought was that if the Go Green campaign was successful, people ought to be reducing their energy consumption. Well, what we have here is, in addition to the people that were encouraged to participate in this Go Green campaign, we also have students and participants that were not in the campaign. And what you see is that their energy consumption looks exactly the same, higher in September and it's lower in November. So it appears that the Go Green campaign, if you only look at that green bar, you'd have to say, wow, it looks like that Go Green campaign is successful. We've got a reduction in energy consumption. But when you look at people that weren't in the campaign at all, you see the same effect. So there must be something else going on. And what we likely have here is a history effect. There's some external event. Well, what external event could be happening from September to November? Well, the season is changing. And usually what happens, at least here in California, is it can be pretty warm in September, and then even in early October you can get some warm weather. Then by November, the weather starts to cool off. So maybe people are just using the air conditioning a lot less in November. So it has nothing to do with a campaign, it just has to do with this external or historical event of a change in seasons. And so seeing this result and having a comparison group allows us to determine, actually no, the Go Green campaign is not necessarily successful, but without having that control group, we're unsure. Okay, here's a result that we would need to see in order to attribute a reduction in energy use to the Go Green campaign. Here, because we see that there's even less energy consumption than the control group, we have to attribute that there's something beyond just a change in weather. So there's definitely decreased energy use for both groups, so maybe there is some seasonal effect, but because there is even more of a reduction in energy use for the Go Green campaign, we can contribute that kind of extra reduction, if you will, to the Go Green campaign. And we can only rule out that history effect because we have that comparison group. Let's go over another example of a history threat. So this is not in the slide, but I'll just review one. So let's just say that you're a researcher and you're interested in the effects of meditation on stress levels. And you think, hey, if we can just get college students to meditate, it will reduce their stress levels. And so you want to measure students' stress levels, say at the beginning of the semester, and then you have them participate in meditation, and then your plan is to measure their stress levels at the end of the semester. Well, let's just say while your study is going on, you've got some very stressful or even violent event that happened on campus. So maybe there's the number of assaults on campus is increased. Maybe there's some incident with an active shooter. Maybe there's been kind of a widely kind of publicized like assault or something like that. And so it's a stressful event that happens. In that case, you might actually see that you don't get the reduction in stress due to meditation because of this history effect. And so it might lead you to believe that, oh, meditation wasn't successful at reducing stress levels, but because there's this event that occurred, to the participants at the same time as the treatment, which was the meditation. All right, so the third threat is known as a regression threat. It's also known as regression to the mean. So this is a statistical concept in which you have either extremely low or extremely high scores at time 1, and those scores are less likely to be extreme at time 2. It's the idea that people move closer to their average. So here's one example. Let's just say that you take a mood survey. Okay, you take a daily mood survey, so you can think about at any moment in time you're in either a really good mood or you're in a really bad mood. Maybe you got a piece of really happy or good news, so that kind of gives you a bump in mood. You're even more happy. Or let's just say you found out some bad news, or you got the result of a test and it didn't go well, so you're in a bad or a grumpy mood. And that happens, it just, coincidentally happens when you're asked to take a mood survey. Then the next day, you're asked to take that survey again. Well, what do we expect? We expect that you're going to move back to your typical average, like whatever your mood is. So if you're typically just kind of normally in a pleasant mood, or maybe you are one of those individuals that is a little bit more cranky, you're going to move back to whatever your kind of daily average is, because at time 1, you had an extreme mood in one way or the other due to whatever it was. So regression to the mean simply means that people move back to their average. So what we have graphed here is our example where we've got the group of depressed women that participate in therapy. The idea is that if we only have the single therapy group, we could have a regression to the mean effect where women are recruited or they volunteer to be in this particular study because they're especially depressed. They're feeling especially down and especially bad. Over the passage of time, they regress towards their more typical level of depression. Okay, so regression here is just the idea that people are moving back to their average. And so what we see in a pattern here, even with a no therapy group, is the idea that our therapy group could have regressed to the mean. Okay, so our no therapy group it reports the same level of depression at time 1 and time 2. But our therapy group, especially if these are individuals that would have been recruited for the therapy or volunteered to participate in the therapy at time 1 because they were especially depressed, what we could see with this reduction is nothing more than a regression effect. What about this result? This result, we see that there could be somewhat of a regression effect here, but that can't entirely account for the results. So in this graph, what we see is that both groups have similar levels of depression at the pretest, but the therapy group had even lower levels of depression at the post-test than the no therapy group. So this is kind of similar to what happens with a maturation effect, but what we have here is that we've got people regressing towards their mean, but regression can't account for how much the therapy group reduced their depression. Okay, so in this case, regression can be ruled out. In this case, it couldn't. Okay, so it's helpful to just look at those two graphs and say, in this case, regression can be ruled out because we see a regression effect with the no therapy group, and we see an even more of a reduction here. But here, we don't know whether this reduction in depression can be attributed to the therapy or whether it can be attributed merely to regression. Okay, and then here's just one more example Um, Here too, we can rule out regression. And this is the case that this is because our therapy group started out more extreme, more depressed than the no therapy group. Okay, so if a regression effect was the only thing that was happening, this orange bar would regress down to kind of this green bar, just like we saw in the first example. But because this orange bar goes past the green bar so that there's even less depressed, we can say, maybe this amount would be a regression effect, but this additional reduction has to be attributable to the therapy. Okay, you wouldn't get this crossover effect where the therapy group is even less depressed than the control group if it was only due to regression. Therapy must have also had some influence. Okay, so the way to assess whether there's a regression effect is to use a control group, and then you need to inspect the pattern. So with a control group, regression is still possible in this case. Regression can't be the only factor here. The therapy must have worked in this example, and then therapy must have worked in this example as well. So definitely take some time to review those graphs. This can be a difficult concept, but hopefully that makes sense, where in this first graph, which is B, I've kind of gone a little bit out of order from the textbook, but it made sense to me to do it this way. Regression could have happened here. Regression can't account for the results in graph A or in graph C. All right, the next threat is an attrition threat. An attrition threat happens when there's a reduction in participants from pretest to post-test. So attrition, that is losing participants, is a problem when it's systematic. And so here's an example of systematic attrition. What we have here in the graph on the left is that we have the two people that dropped out of the study. They're indicated in blue, and so we don't see them anymore at time 2. So they're present at time 1, they drop out of the study, and then they're not there at time 2. So that's systematic attrition when you get people that are on the extreme end of the distribution that are more likely to drop out. So the people that have especially high scores or people that have especially low scores are systematically more likely to discontinue. Okay, so these are people that have the highest levels of depression, and because of their depressed state, that just makes them less likely to be able to do the things that they need to do to continue in the study. So what we have here is, again, let's just say that we're looking at a therapy to reduce depression. Because we lost our most depressed people, we see that there's an effect on the mean. Okay, so when considering our most depressed people, our group average is 5.71, but merely because we've lost those two depressed people and they're not included in the mean, it looks like our mean, like our average depression level, is going down. But that's not due to anything real. That's due to the just losing our most extreme scores. Here's an example where we don't have what you'd call systematic attrition. So what's graphed here is that if you lose the people that are at the average, you won't see an effect on the overall average. Okay, that's just a statistical concept, is when you lose scores or observations that are at the average won't change. Okay, so you could lose people that are at the average. You could lose somebody who's your top and your bottom, right? Because that would essentially, those scores would not affect the average if you lose. So when you have either people that drop out that are in the middle of the distribution, or like one from the top and one from the bottom, that would be unsystematic attrition, and that won't affect the mean. The way to prevent attrition is actually quite simple. When participants drop out of the study, you just don't calculate their scores in the pretest or at time 1. Okay, so if these people dropped out and they're not present at time 1, we would just recalculate the time 1 average, excluding their scores. So that's a pretty easy fix on the attrition. But it's worth thinking, are there any participants in my study that might be more vulnerable to dropping out, and that would potentially create a threat to attrition. All right, the next threat to internal validity is known as a testing threat. And a testing threat I reviewed in a previous lecture, but it's really a type of an order effect. And so it's an order effect in which there is a change in your participants as a result of experiencing the dependent variable more than once. So very often the dependent variable is some sort of a test. Okay, you could literally give people a test of their cognitive ability. You could see how well they do on different standardized tests like numerical ability or verbal ability. But testing refers to a more general phenomenon of experiencing the dependent variable, having to be assessed on the dependent variable, and doing that once affects the assessment on the second time. So one way that you can have a testing effect is that your participant scores improve due to practice. So that's a specific type of testing threat known as a practice effect. So people just get better, they get more skilled at solving the problems, and that would happen anyway, without any intervention, without any experimental manipulation. People will just get better over time as a result of practice. And that's when you test people or ask people to have a performance or display a skill. You could get a practice effect. Another type of testing threat, though, is that you can get a fatigue effect. So particularly when asking people to do something where they need to exert themselves physically, having the time 1 and time 2 measurement of the dependent variable in somewhat close proximity, you could experience a fatigue effect where people just get tired. So when researchers measure things like attention or attention span, it's important to space out the measurement of your time 1 measurement and your time 2 measurement, because paying attention for extended periods of time is fatiguing. Things in which people are asked to do exercise or lift something heavy, you have to space out your measurement of your dependent variable at time 1 and time 2 because people get tired, they get fatigued. Testing effects, of course, affect internal validity because it's not clear if it's the treatment or the manipulation of the independent variable or the intervention that is the cause of the change in your dependent variable, or whether it's merely attributable to a practice effect or a fatigue effect. So there's a couple ways to prevent a testing effect. The first is not to use a pretest. So if people get better because of a practice effect, don't give them the ability to practice. Okay? Or if they get tired due to a fatigue effect, don't give them the opportunity to get fatigued. You can just do a between subjects design or an independent groups design, randomly assigned to condition, and then only measure the dependent variable once. So that would be a post-test only design. That would get around a testing threat. Another thing that you can do, and this would be especially the case for tests of cognitive ability, would be to use alternate forms that are equivalent. And so sometimes we see this when we give people tests of their numerical ability or verbal ability. SAT problems or GRE problems are commonly used in psychology. What researchers do is they come up with 2 different sets of problems that are designed to be equivalent, and that way there's potentially a little bit of a practice effect, but because the problems aren't the same, the hope at least is that the practice effect should be minimal. Okay? And then finally, having a comparison group is also helpful. So in the first graph, we don't necessarily know whether we've got a practice effect going on here. But in the second graph, where we've got a treatment group and a comparison group, maybe it appears that there's a practice effect or some sort of a testing effect for both groups, But because we see more improvement in ability for the treatment group, we can't completely attribute what's going on to practice. We see more of an improvement. So some amount of change is due to practice, but the additional improvement is due to the treatment. So having a comparison group is a way to assess and parse apart, do we have how much of the effect is due to testing, and then how much is due to the effect of the treatment. All right. So another threat is known as instrumentation. And this is at first going to seem somewhat similar to testing, but I'll try to differentiate the two. So an instrumentation threat occurs when a measuring instrument changes over time. Okay, so let's go over some examples. Oftentimes in social and behavioral sciences and in psychology, we want to measure behavior, and we do this using observers or judges or raters. What can happen is that even if there's like a rating system or a coding scheme, observers can change the criteria that they're looking for, or even their use of a coding scheme over time. So that could be one way in which you could get an instrumentation threat. Another thing that you could do is I just, in the previous example, talked about using two different forms of a test at pretest or posttest. Well, you get an instrumentation threat if those forms are not equivalent. So if one form of a test is, say, more difficult than the other, or one is easier than the other, you've got non-equivalence, in which case a change over time might be not due to any kind of treatment or intervention. It could merely be due to differences in the difficulty of the tests. So that's another example of instrumentation. A third example of instrumentation is very simply, in some cases, researchers use equipment or technology, and it just literally wears out and becomes less precise over time. All right. Let me give some specific examples. So one of the more common instances of instrumentation, especially in psychology, would be for observers or raters to become more proficient in using a coding scheme or a rating system when observing behavior over time. Okay, so the researcher essentially becomes more practiced and skilled. So let's consider researchers that are in an elementary school. They're in a classroom, and their goal is to observe children's behavior to see if they're paying attention, engaging in behaviors that would be considered on-task behaviors. Over time, those researchers may become more accurate in using their coding scheme and identifying behaviors that they would code as being on task or paying attention. Okay, so they just get more accurate at identifying those behaviors because they become more practiced at using their coding scheme. So therefore, those researchers might conclude that over time, the children are paying more attention and are being more on task. And they might attribute that to something about the teacher, like the teacher is more skilled, or the children are learning, or whatever is happening in the classroom is attributable to the children being more on task. But it could have nothing at all to do with the teacher, it could have nothing at all to do with the children, and it has everything to do with the way that the researchers are using their coding scheme and becoming more skilled at identifying on-task behavior over time. So that's an instrumentation threat. Okay, the other example, let's go back to another example of instrumentation, which has to do with using alternate forms of a test. So we've actually encountered something like this in a previous lecture where you might recall the research on mindfulness. And the idea was to say, when people are trained to be mindful, does that improve their cognitive ability, and does that help them perform better on standardized tests of, I forget exactly what it was in the research, if it was SAT problems or GRE problems, and whether it was math or verbal ability. But let's just say it's GRE problems, which is graduate records exam, and it measures verbal ability. So in that research, the researchers tested people at time 1. The participants participated in a mindfulness intervention, and then either 1 week or 2 weeks later, they completed a different set of GRE problems. Okay, and so the idea was that those two sets of problems are supposed to be equivalent, and therefore, if we see improvement, it has to be due to the mindfulness training. However, what if that second set of problems was easier? If the researchers just didn't do that great of a job in making the two different sets of problems equivalent, if the second set of problems was easier, they would see improvement from time 1 to time 2, and that could have everything to do with the test just being easier and have nothing at all to do with whether the mindfulness worked or not. Okay, so in short, there's another example of instrumentation. Okay, how to prevent? You can just use the post-test only. Okay, so in that case, any improvement of observers in being more skilled in recognizing behavior, that's addressed. Whether the two forms of a test are equivalent, that's addressed. So you could just use the post-test only. Alternative, let's go back to the mindfulness study. If there was some concern that your two sets of problems were non-equivalent, you can counterbalance the order. So just split your groups that are participating in the mindfulness intervention, and one group does, let's just say, set A first, followed by set B. The other group does set B first, followed by set A. And that way you'd be able to parse apart whether one set of problems is easier than the other and be able to determine whether there's still a mindfulness effect. And then including a comparison group. So in the mindfulness training, let's just say that the set of problems were not equivalent and the second set of problems was a bit easier. Well, if you've got a control group, you're going to expect that they perform better on that second set of problems as well. But if your mindfulness group performs even better than that control group, you've helped to address that instrumentation threat, because you can still see an effect of the treatment because you've got that control group. Okay, so then just to review the difference between instrumentation and testing threats. In an instrumentation threat, it's the measuring instrument that has changed in some way from time 1 to time 2. So either literally the measuring instrument is different, like a set A problems and a set B problems, and they're not equivalent. The measuring instrument, you could think of the researchers as the instrument, and their use of a coding scheme improves. So that has changed over time. So with instrumentation, it's the way that we're measuring changes. With a testing threat, it's the participants themselves that are changing from time 1 to time 2, from a pretest to a post-test. So in that case, they're tested on the exact same thing. Okay, so if it's lifting a weight, the weight is exactly the same, but they've gotten tired from pretest to post-test. Okay, it's still 10 pounds, but that same weight, they're just fatigued at time 2. So with a testing effect, the participants themselves have changed. All right, now it's possible to have combined threats. So selection threats happen when you've got one group of participants that is systematically different than another. And you can have a combination of a selection history threat when you've got an outside event or factor that systematically affects participants at one level of the independent variable. Okay, so if we just have a two-group design, one group of participants have a history of threat, but the other does not. Okay, so there's only an external event that only affects one group. So let's just, as an example, let's just suppose that you're doing a study of the effects of meditation on stress. Okay, I've referred to this before, but I'll come back to it. And so your hypothesis is that, students that meditate, that reduces their stress. And so, very simple study, you're going to just have students from two different psychology classes, and one psychology class is going to do meditation treatment during the course of the semester, and the other one is not. Okay, and that other one that is not is going to be the control group. But let's just say that during the course of the study, the control group instructor has some significant life event, maybe the birth of a child, maybe a divorce, but you could think of anything that happens in that instructor's life that distracts their attention from being a good teacher. And so they're no longer a good teacher, the class becomes haphazard, it's unclear what's going on, tests are haphazard, deadlines are shifting. It turns out to be a stressful situation for students. So then when stress levels are measured at the end of the intervention, it looks like students in the meditation group are a lot less stressed out. But that could be because there was this history threat in the control group. And the control group is actually more stressed out due to this event that happened with the instructor. Okay, so that's an example where you could get a selection history threat. It's also possible to get a selection attrition threat. And this would be where you have participants in one experimental group experience attrition, but participants in the other group do not. So here's our example with this. Let's just say you're going to do a study on the effectiveness of 2 different treatments for depression. The first treatment is just basically a standard cognitive behavioral therapy plus medication where participants go to therapy sessions. It's in a location that is just a therapist's office. It's very easy to get to, commuting either using a car or public transportation. It's an hour a week. It's basically fairly easy. We'll just boil it down to it's easy to participate in that particular group, that particular experimental group. However, the other treatment, let's say the other treatment uses something known as transcranial magnetic stimulation. This is actually a real thing that is a treatment for depression. It's a non-invasive stimulation of the brain. And basically what happens is stimulation to the brain is produced by generating a high-intensity magnetic field by passing a brief electrical current through a magnetic coil. Okay, so your brain gets stimulated. So to participate in transcranial magnetic stimulation, patients have to go to a special treatment center. It's a laboratory facility. It's outside of whatever metro area they're at. It's the commute to get there is not easy. It takes longer. It's a more onerous procedure to go through this treatment. Like it takes longer. There's a setup. You have to have more stuff done to you. So we could boil this down to say it's just a more difficult experimental group to be participating in. So interestingly enough, what you could have is people that are more likely to drop out in that particular condition. And if the people that are particularly likely to drop out in that condition maybe are the ones that need it the most, that could be a real problem with attributing the success or the lack of success of that particular intervention. So a selection attrition threat would happen when participants in one experimental group experience more attrition than others for various reasons, but in the one that I outlined is in some cases it can just be more difficult to participate in one level of the independent variable or in one treatment group versus another. So in addition to these 6, there's 3 potential internal validity threats that are present in any study. And so one is a bias that we've talked about in previous chapters, which is observer bias. And this is the idea that a researcher's expectations can influence how they interpret their results. So let's just say that you're a researcher and you're interested in whether you've got a therapy that reduces depression. If you're a researcher and you're studying your own clients, you might expect to see your patients improve whether they do or not. And so it could be that bias that is then responsible for one's clinical evaluation or judgment that depression is reduced. Okay, just because of the expectation that the therapy that you're giving is going to work. Going way back to the rowdy camper example, let's just say that we've got these, our own expectations is that sugar is bad, and so switching our campers to the low sugar diet, we might end up viewing our campers' behaviors as less rowdy and more positive just due to our expectations that by reducing the sugar, there's a change, okay? So maybe it's the same rowdy behavior, but because we expect the sugar to work, we are kind of like characterizing that rowdy behavior as just like more playful. Okay, so those are observer bias. And so those would be present even with a comparison group, and potentially even more present with a comparison group. So if you split your campers and say, okay, half of you campers, you just have the normal diet, and the rest of you campers, I'm going to reduce sugar, okay? Observer bias is still present, especially when a researcher is not blind to the hypothesis. Okay, if I know that those are the kids that still have the sugar, those are the kids that don't have the sugar, my expectations in judging their behavior is likely to be influenced by my prediction about what the sugar ought to do. Okay. Demand characteristics occur when participants figure out the hypothesis and change their behavior in the expected direction. So when participants know what the hypothesis is, they kind of play the role and act the part, and try to act in a way that will confirm the hypothesis. And then we've got the placebo effect there, which I'm actually going to come to on the next slide. But in order to control for observer bias as well as demand characteristics, researchers should use a double-blind study. And so a double-blind study is designed so that neither the participants nor the experimenters that are working with the participants know who's in the treatment group or who is in the control group. And so this should reduce both researcher expectations as well as participants' expectations, which creates the demand characteristics. If a double-blind study isn't possible, then an alternative is a masked design, which is otherwise known as just a blind design, in which participants know which group they're in, but the observers don't. So oftentimes when you might have a researcher, so that the researcher knows their own hypothesis, but that researcher might hire or get volunteer research assistants that would be involved with, say, coding of behavior. And those research assistants, they don't know what condition of the study people are in. They're completely blind to the hypothesis. They're blind to condition. And they're just going to code behavior without knowing what experimental group participants are in. So that's a blind, not necessarily a double-blind design. All right, and then so finally let's talk about placebo effects. Placebo effects happen when a research participant shows improvement because of their belief that they've received a treatment. So the improvement happens not because they actually get some drug or some substance or an effective treatment, but just because they think they do. So participants that are told that they're getting medicine, pain relieving medicine, or even something like a caffeine, but when the active ingredient is actually missing, they still show an improvement. And this is called a placebo effect. So what we have here is a true therapy versus a placebo therapy. And so in order to rule out a placebo effect, we need a special comparison group. And what happens is that so people that receive the placebo therapy or the placebo medication neither the people working with the participants nor the participants actually know who's who. So that's a double-blind placebo control study. Okay, so neither the people that administer the treatment or the drug or the participants themselves know what they're getting. So interestingly, here on this graph to the left, you can see that both group, the true therapy and the placebo therapy, had symptoms that decreased. So we would see some improvement due to the therapy as well as the placebo. However, the group that got the true therapy improved more than the group getting the placebo. So this suggests that the therapy had some effects. And this is very important in pharmacy trials, giving people medicine, giving people therapy. The power of positive expectation on the part of participants is a very real and documented phenomenon. Okay, just having positive expectations has been shown to reduce reports of different symptoms that are associated with illnesses, reports of pain. So giving people nothing other than something that is an inactive pill or injection instills a positive expectation, and that positive expectation is enough to then result in a reduction of symptoms or pain. And that's been documented throughout the medical literature extensively. So placebo effects, like the one that is graphed here, is very real. And for that reason, it is common to include a placebo group when testing a new medication or a therapy. And to be considered effective, that true therapy or medication needs to show an effect beyond just the placebo. How do you know whether this is a true placebo effect versus one of our other threats to internal validity? This could be merely maturation. There could be a regression effect here. Is there testing? Is there instrumentation? How do you know that it's a placebo effect and not one of those? The graph on the right will demonstrate a placebo effect. So if you've got a third group that gets nothing at all, so they don't get a pill, they don't get a medication, they don't get a therapy, they get nothing, okay? What we see here is a true placebo effect because the placebo group that didn't get the true therapy but got the placebo shows an improvement beyond a group that got nothing at all. So in this first case, we can't totally conclude that there's a placebo effect here. In the second case, we can, because we see that the placebo group improves relative to a no therapy at all. All right, so many threats to internal validity. In fact, in this class so far, we've learned that there's 12 different threats to internal validity. I reviewed 3 last time, and then we learned 9 today. So you might think, why do we even bother to conduct all these experiments with all of these threats? I want to point out that, especially when it comes to the 6 threats here, so maturation, history, regression, testing, instrumentation, and attrition, these are really only present in the really bad experiment design where we've got a one group pretest, post-test. So designing experiments that have a control group can be used to rule out these 6 threats to internal validity. It's important to know about these 6 threats to internal validity, I think, especially as a consumer of research or as somebody that will at one point work in an organization or work in a company or just want to make cause and effect conclusions about the world. Lacking a control group, okay? And so trying to make conclusions about yourself, about other people, about the success of one's business, lacking a control group, you'll always be susceptible to these 6 threats to internal validity that occur just like from a pretest to a post-test, just due to passage of time. So be on the lookout for these and always think to yourself, yeah, but do I have a control group? And if I don't have a control group, could it be maturation, history, regression, testing, instrumentation, or attrition that is responsible for the results? I think kind of in our everyday lives, regression to the mean, which admittedly is a statistical concept, but I hope it's intuitive, it happens all the time. And often our, what we have is a confounding of the passage of time with some event. And so it's very possible to misattribute some event as having an effect on our mood, having an effect on the way that we feel about ourselves, and it's really could be nothing more than just being especially happy or grumpy or having a good day or a bad day, and then just kind of regressing to average over time. So things to be on the lookout for. These tables are in the textbook, and I think that these are very helpful to summarize each of the threats to internal validity. There's definitions, there's examples, and then when reading experimental research, these are the questions to ask in terms of interrogating the internal validity of a particular study and trying to identify whether these threats are present. So definitely make sure to review this table. It's a lot, but hopefully the examples that I reviewed in this lecture are helpful to understand these threats.